I'm going to begin by scanning the room. That is a toy. Okay, let me plug this in. Okay. My name is Jaylee Carpenter, and I am an F&P student at West Texas A&M University. Today I'm performing an advanced head-to-toe assessment on a 26-year-old male. Prior to the start of the assessment, I obtained a general survey that included vital signs with height and weight, as well as a BMI, which is normal for this patient. We also assessed allergies, he was allergic to penicillin, past medical history, social history, surgeries, immunizations, family history, medications, and diet and exercise habits. I also assessed cranial nerve number 2, the optic nerve, prior to this exam with the Snell eye chart. I have washed my hands, and I'm going to begin the assessment. I'm going to adjust this really quick. Okay. So first I'm going to start off with the head. I'm going to look at the head for symmetry and size, and then I'm going to palpate the scalp. I'm going to be looking at the hair distribution to see if it's even or uneven. I'm going to be looking for bumps, lesions, tenderness, any edema. I did not feel any kind of nodule or masses, and his hair distribution is even. Okay, now I'm going to look at the face. I'm going to look at the facial features and ensure they're symmetrical. I'm going to be looking for lesions, bruising, rashes of any kind. I'm also going to be looking at his eyelids to note any drooping. I'm going to palpate his temporal arteries and see if they're 2+. They are 2+. So next I'm going to assess the temporotransmandibular joint. I'm going to ask the patient to open and close his mouth a couple of times as I palpate the joint. I'm going to be assessing for cracking or popping that could indicate an issue in the joint. I'm going to assess cranial nerve number 5 now. So I'm going to use a cotton ball and a blunt end object, and I'm going to ask the patient if you can close your eyes and tell me if you feel something dull or something sharp.
Dull. Sharp. Dull. Sharp.
Okay, now I'm going to be looking at the eyes. So I'm going to be looking at the position, and if you could look up at me, I'm going to be looking at the position of the eyes. I'm going to also look at the sclera and the conjunctiva. The sclera should be white, and I should not notice any kind of yellowing that could indicate liver issues. I'm going to check the pupil's reaction to light. I'm going to ensure they are equal, round, and reactive to light. I'm going to be checking cranial nerves number 3, 4, and 6 by checking the extraocular movements by checking the 6 cardinal signs or positions. So I'm going to have you follow my pen light with just your eyes and not your head. So by doing this, I am checking for nystagmus or any other abnormal ocular movements. And I already have assessed cranial nerve number 2 with a Snell eye chart. His vision was 20/20. So now I'm going to check the optic disc. I'm going to be checking for any abnormalities on the optic disc or the retina. So I'm looking for any kind of papilledema or any other abnormalities. Okay, we're going to move on to the ears now. So I'm going to be looking at the ears for symmetry, how they align for the face, the size in comparison to the face, and then now I'm going to look into the ears. For adults, I'm going to pull the pinna back and up. As I'm looking in the ears, I'm checking for the tympanic membrane. I'm looking for any redness or swelling. A normal tympanic membrane will be shiny, pearly gray, translucent. I did not notice any abnormalities, redness. I'm going to assess cranial nerve number 8 with the whisper test. Okay, just to repeat what I say.
66. 88.
Okay. Okay, now I'm going to perform the Weber and Ray test. I'm going to do the Weber test first. This is used to detect unilateral conductive hearing loss. So I'm going to ask you to tell me when if you hear both sounds evenly on in both ears.
Yes.
If the sound is heard evenly in both ears, the test is within normal limits. The Ray test can be used to determine hearing loss in one ear. It compares the air conduction with the bone conduction. Tell me when you stop hearing the sounds on this one, and then I'll move to this position and tell me when you stop hearing that sound as well.
Okay. Okay. Okay.
The air conduction should be heard 2 times longer than the bone conduction. I'm going to move to the other ear. Tell me when you hear it stop.
Okay. Okay.
Now I'm going to move on to the nose and sinuses. You can look up just a little bit. So I'm going to look at the nose shape, symmetry, and compare it to the face. So using my pen light, I'm going to look at the inside of the nose, looking at the oral mucosa, also patency. I'm going to look at the oral mucosa's color, see if there's any kind of swelling or drainage. And while I'm also looking there, I'm going to look at the septum and see if there's any deviation in the septum. There is his nasal mucosa is pink. There's no deviation in the septum. It's midline. I'm going to check for patency of your nares. So if you would go ahead and plug one side of your nose and take some deep breaths in and out. Okay, now do the opposite. Okay, nasals are patent. I'm going to test cranial nerve number 1. I'm going to have you go ahead and close your eyes and tell me what you smell. And what do you smell?
Coffee.
I'm gonna palpate the frontal and maxillary sinuses. Go ahead. Okay, and I'm just checking for any kind of tenderness that the patient might have. And so now we're going to move on to the neck, mouth and throat. So upon inspection, I'm going to just look at the color and moisture of the lips. I'm going to be checking for any kind of cracks, ulcers, cold sores. The patient does appear to have a small cold sore on the bottom lip that is healing over and it is now scabbed. Using my pen light, I'm going to look inside the mouth. So I'm just going to look at the oral mucosa for the color, any dryness, swelling of the gums or anything. His oral mucosa is pink, moist. I don't see any ulcers. I also looked at the teeth in there. There's no missing teeth. So I'm going to go ahead and look at the tongue now. I'm looking for symmetry, any ulcers. I'm also going to look under the tongue, if you could pull your tongue up, making note of that color or any kind of ulcers or abnormalities under there. His tongue is pink, moist, no cracking or issues there. His palates are intact, and they look good. I'm going to have you stick out your tongue and move it from side to side. Okay, good. This is testing cranial nerve number 12, the hypoglossal nerve. And now I'm going to get this. I'm going to check cranial nerve number 9 and 10, the glossopharyngeal and the vagus nerve. This is done by checking the gag reflex. Okay, as I place the tongue dispenser in, I'm going to watch the elevation of the palate and the position of the uvula. And then also, I'm going to go ahead and have you open your mouth again and say, ah. And then I'm going to watch the movement of the uvula. I'm also looking at the tonsils. I'm going to look at the size of the tonsils and see if there's any kind of inflammation of the tonsils, and I do not see any issues there. He has had his tonsils removed. I'm going to test cranial number 7, the facial nerve. So I'm going to go ahead and have you smile. Okay, and then I'm going to have you puff out your cheeks a couple times. Okay, and then push out your lips. Okay, perfect. That looks symmetrical. I'm looking for any asymmetry there, and his smile is asymmetrical, and he can puff his cheeks. I'm going to be checking the necks now. So I'm just going to look at symmetry, any known visual masses. I'm also going to be looking at the tracheal, if it's midline, and it is. So I'm going to palpate the thyroid now. I want to make sure there's no masses, lumps, or tenderness in here. I do not feel any lumps or masses. Is there any tenderness?
No.
Okay. I'm going to palpate the cervical, post-cervical, subclavicular lymph nodes, and submandibular. I'm just checking for swelling or tenderness. They should be small, free moving. They should not be hard or fixated and non-movable. And his are soft and fine. I'm going to check your neck range of motion. Okay. I'm going to have you move your head from side to side. And then back and forth. Yeah. Okay. Any tenderness or okay. Nope. I'm going to check cranial nerve number 11, this spinal accessory nerve. If you would just go and push up your shoulders. Okay. And more time. Okay, it's symmetrical and strong on both sides. No issues there. I'm going to check muscle strength of your neck. I'm going to have you turn your head towards my hand. Perfect. Other side. Okay. And And then now I'm going to check the carotid arteries. I'm going to check them one at a time. I'm going to make sure they're equal bilaterally and 2+. Okay, they appear equal bilaterally on both sides, and they are 2+. And now I'm going to also take the carotid arteries for whooshing or bruise. No whooshing sounds or bruise are heard. We are going to move on to the chest, back, respiratory system, and cardiac system. So we are going to actually, I'm going to have you take off your shirt now, and then we're going to move the camera around so that we get a better angle of the back. If you would go ahead and just face that way. Okay, that should be good. Okay, be able to see where we go. Okay, so I'm gonna just inspect the back first. I'm gonna be looking for any kind of abnormalities. I'm going to be looking at especially the respirations and make sure they are symmetrical. There's no laboring or asymmetry. Make sure there's no signs of distress as he has his respirations. I'm also just going to be inspecting the generalized skin in the area, make sure there's no issues, bones or bulges I can see. I don't see any kind of issues on the back, and his respirations look even on the posterior side. So I'm going to be checking this chest expansion. So I'm going to place my hands here, and I'm going to have him take a deep breath in and out. One more time. So I'm watching my thumbs, making sure that they pull apart easily and then come back together easily as he is breathing in and out. And they do, so his breathing is symmetrical. I'm going to be checking for tactical firmitus now on the back. I'm going to be checking the vibrations throughout the lungs as the patient is talking. So I'm going to have you say 99 every time I move down in a louder position. Okay, so we'll begin here, say 99.
99. 99. 99. 99. 99.
I'm going to be checking for costovertebral tenderness. Any tenderness there?
No.
Okay, no tenderness is noted. And now going to percuss to see if there is air or fluid inside of the lungs. A normal air-filled lung will have a resonant sound, whereas a hyperextended lung will be hyper-resoundant, and then dullness will indicate fluid in the lungs. Okay, all areas were sounded. Now I'm going to assess the diaphragmatic excursion. So the first thing I'm going to have you do is inhale and then hold that. Okay, here's the area of dullness. You breathe normal for a second, and then I'm going to have you inhale, exhale, and then hold that. Okay, between these two areas is the point of diaphragmatic excursion. The screen went black, so let me just make sure it's still recording. Okay. Now I'm going to just assess for lung sound. I'm going to check for adventitious lung sound, such as cracking, wheezing, rails. Take a deep breath in and out. Now I'm going to check for agophy, bronchophy, and whisper-pesticality. Okay, I'm going to have you repeat after me. 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
99. E.
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 No agophony or bronchophony, no is noted. So we're going to go ahead and move back to the anterior chest. So I'm going to have him face back to where we were just a second ago. Okay, let me make sure that's okay. Okay, so we're going to begin the anterior chest assessment. So I'm just looking again at the respirations to make sure that they are even and symmetrical. I'm going to also assess the posterior and anterior of the chest to make sure there's no concaving or barreling. I want to palpate with the balls of my fingers and the tips of my fingers for any thrills. No thrills were felt. I'm going to palpate the maximum point of impulse of the heart. And I do feel on this patient. I'm going to percuss the anterior lymph fields now. Again, for checking hyperresonancy and dullness. Just right there. Now I'm going to also take the lungs, again check for any adventitious lung sounds, cracking, wheezing. Take a deep breath. I'm going to check the lateral lung sounds as well. So now I'm going to check the heart, auscultate the heart sounds. So first I'm going to check the aortic valve, the second intercostal space, right sternal border, and then the pulmonic valve, second intercostal space, left sternal border, the tricuspid valve, the fourth intercostal space, left sternal border, and then the mitral valve, the fifth intercostal space, midclavicular line. Okay, S1 and S2 sounds are heard, and there is no extra heart sounds. So now I'm going to check for murmurs. I'm going to check with the bell stethoscope. Okay, no murmurs were found. So I'm actually going to have the patient lay back at a 30-degree angle. Okay, you can lay back. And I'm going to move the camera so that we can see a little better. Oh. Perfect. Okay. So he's laying down at a 30-degree angle. I'm going to be checking for jugular venous pressure. So I'm going to have you turn your head to the left just a little bit, and I'm going to be looking at the right side of the neck. I'm going to be looking at the external jugular vein. I have my centimeter ruler and then the index card, which is just my Snell eye chart. I'm going to be finding the highest point in the meniscus of the external jugular vein. And then I'm going to measure, place the ruler at the sternal angle and measure across. This patient is about 3 1/4. It should measure about anywhere from 3 to 4 centimeters. Okay, since I have the patient here, I'm going to do the abdominal exam, but I'm going to lay him flat for this. Okay, go ahead and lay back down. So I'm just going to inspect the abdomen for any masses, symmetry. I'm going to be looking for any scars, surgery scars, trauma scars. I'm also going to be looking at the umbilicus for any bulging or inflammation. I'm going to go ahead and listen to the bowel sounds. Okay, they're normal active, and now I'm going to listen to the abdominal aorta and the femoral arteries. No wishing or bruise noted. Now I'm going to percuss. You will hear tympany over the intestine or stomach, and then dullness will be heard over solid or solid containing organs. So now I'm going to go ahead and measure the liver size, and I'm going to start by percussing from the right of the umbilicus. And I'm going to move up until I hear the dullness. And the dullness will indicate the bottom of the liver. Okay? And then once I have that spot noted, I'm going to go from the midclavicular line right under the nose hole. And when I hit dullness, that will indicate the top of the liver. Okay? I'm also going to assess the spleen for any dullness. I'm going to perform a light palpation of the abdomen now. This will check for any kind of tenderness or pain. I'm going to make note of the patient's facial expression, see if they have any grimacing. They may have some guarding as well. And I'm also going to check for masses. Patient does not seem to be experiencing any kind of pain. I don't feel any kind of masses. And now I'm going to do deep palpation. So I'm going to go and place my hand under the back, and then I'm going to have you breathe in and out. The liver should be smooth, and his is. I'm going to palpate the spleen. I'm going to also put my hand behind. Breathe in and out. The spleen is not palpable, which is typical. Now I'm going to do both of the kidneys. Okay. Okay, I'm going to have you, since the patient is still laying down, usually I would assess the genitalia and rectum. Due to this patient's age and he doesn't have a family history of any kind of prostate cancer, there's no need to do a prostate exam on him. For rectum, for a woman and man, we would assess for tenderness, sphincters, fissures, hemorrhoids, any abnormalities, tears. If the patient was a woman, I would assess the vulva and vagina for any abnormal discharge, as well as swelling, cyst, warts, any abnormalities there. And I'm going to go ahead and have, I'm going to go ahead and assess, I'm going to scoot back because I'm going to assess for herniated disc. Okay, go ahead and pull your leg up. And then dorsiflex your foot. Perfect. Next one. Dorsiflex your foot. Okay. Now we're going to raise both legs. Dorsiflex and pull towards me. Okay, now push. Okay. Okay, now we're going to check the range of motion in the hips. Oh. Let's get that back just a little. Okay, let me raise this leg up. Okay, we're going to do flexion, so for your knee. Extension, we can actually move just a little. Okay, and then abduction, adduction, external rotation, internal rotation, extension. Okay, next leg. We're going to do flexion, extension, abduction, and then adduction, external rotation, and then internal rotation. Okay, I'm going to have you sit up. We're going to do your shoulders, so we're going to do abduction, out, adduction, cross, external, internal. Okay. Now we're going to do the elbows, so just push down. Okay, perfect. And then your wrists, posteriors. Perfect. Okay, I'm going to move you closer. Okay, so I'm going to check the remaining pulses. So we're going to check the brachial, radial, popliteal, and dorsal pialis. So I'm just making sure all these are 2+. And posterior thallus, we'll do both hands. And the dorsalis pedis. Along down here, I would also be checking the niblets for any clubbing. I'll also be checking capri fill. Then I'll be checking the legs for any edema, hair distribution, scars, abnormalities, any kind of issues with the legs or feet. I would also want to check the capri fill on the fingers and then check the hands for any edema as well. We're going to do some neuro checks real quick. So I'm going to have you close your eyes and see your hand. And then I'm going to have you tell me what number to draw on your hand.
8.
Okay?
8.
Okay. I'm going to place an object in your hand and tell me what that object is.
Key.
Okay. I'm going to do some reflexes. So I'm going to do the triceps. So I'm going to have you do your arms like this. Okay, I'm going to do your brachial radial. So just hold your hands out like this and relax back. Make sure your pinkies relax. And this one. Relax. Okay, and I'm going to check your popliteal. So will you sit back a little and let your legs dangle? Okay, now I'm going to do the Achilles reflex. Okay, I'm going to have you stand up. So, stand right there. Oh, go back. Go ahead and close your eyes. So I'm going to be checking for balance. That's a Robert's test, and he seems to have good balance. Okay, so now I'm going to have you walk with your heel to toe towards me. Okay, go ahead. Okay, now turn around and walk back. Okay, and if you'll stop there, I'm going to go ahead and have you bend over and touch your toes. So I'm going to be checking for the spinal curvature here, for any scoliosis. I'm also going to be checking for any like bulges or any abnormalities in the spine and the SI joints. Come up about halfway. So I'm also going to check the spinature a little bit more, again, for scoliosis or any kind of abnormalities in those SI joints again. Okay, you can go ahead and stand up. And this is the end of the assessment.